Today we learn something about anxiety. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Definition: it's natural response of a body to stress. Basically, it's a feeling of apprehension or fear. These things are quite common, so some anxiety is normal. If you give a public speech or go for a job interview or joining a new job, then we do get some kind of apprehension or fear, and it's a natural response of a body to stress. And if the stress goes for more than continuous for 6 months together, then it is called anxiety disorder. Females are more predisposed than males. There are different types. You get the panic disorders, you get the phobias, in which you feel afraid of something, social anxiety disorders, then we have the OCDs, obsessive compulsive disorders, separation anxiety disorders, going to hostel from home, away from home or parents, illness anxiety disorders because you've got some illness, you're afraid of that, and post-traumatic stress disorder. This is usually secondary to some bad effect of some childhood trauma or something, or just suppose you've got an earthquake or you've seen a tsunami or seen a near person die and you get a nightmares of the same thing. So this is something like post-traumatic stress disorder. These are all different types of anxiety disorders. Symptoms. So sometimes the patient may feel heartbeat faster or forcefully, fast breathing, difficulty in concentration, difficulty in getting sleep, irresistible desire to move around. So these are the common symptoms of anxiety. Now you may get some anxiety attacks also, that is feeling of apprehension, worry, distress out of proportion to the original trigger, and this takes time to develop. Symptoms may vary in the same person from time to time, and it may vary from person to person. The various symptoms of anxiety attacks. So the patient may feel like fainting or giddy. They may have shortness of breath, dryness of mouth, sweating, distress and fear, numbness or tingling, and persistent feeling of worry. These are the symptoms of acute anxiety attack. The various causes again, it can be due to genetic causes, familial, it can be due to environment. When you go into a particular environment, you get anxiety. It can be due to brain chemistry, which is again partly genetic. Withdrawal from substance abuse, so you're taking some alcohol or some drugs and you withdraw from that, that causes a bit of anxiety. And some illnesses are associated with anxiety, and these are called the medical factors. Approach. So no single test proves anxiety. You need a detailed history, a detailed physical examination, certain questionnaires, and may require tests. Treatment. Treatment again requires lifestyle modifications, counseling. Again, treatment is by psychotherapy and medications. I will not go into the details. Non-medical treatment may be better. Adequate sleep, meditation, physical activity and exercise. So all these are the non-medical treatment. Healthy diet, avoid alcohol and smoking, avoiding anxiety, do the stress management, and of course we get support networks. So these are the different types of non-medical treatment. Thank you for watching the video. Please do not forget to like the video. Feel free to give comments. Please subscribe to the channel and share the link with your friends. Thank you once again.